Fat transfer to the breast are one of the unique things in plastic surgery where we're actually doing one thing that benefits another. Or we're sucking fat out of somewhere you don't want it and putting fat somewhere that you do. And it sounds awesome. And that is a fat transfer to the breast. And that's what we're going to talk about today. I'm Dr. Matthew J. Nykiel, board certified plastic surgeon in Southern California. I have offices in Newport Beach and Upland, California. And let's dive into that fat transfer to the breast. So the first most common question I get from a goal standpoint is, well, where can we take this fat from? And the answer is, well, really anywhere that you like that we can perform liposuction. And that, I think, is one of the first benefits of why fat transfer to the breast is so enticing to people, because we can remove fat from somewhere that was a problem area for you and move it somewhere where you want more volume. The second question I get asked all the time is, well, how much volume can you put in the breast? And this is where we have a little bit of limiting factor. Usually we can get somewhere around 50 cc's to 100 cc's in each breast. That's usually about the maximum. And we're going to see somewhere around 50% of the fat to 80% of that fat survive. It typically will add just a little bump to the breast. Most of the time we say it bumps it up by roughly about a cup size to the breast. It typically won't go more. Now, you can perform this procedure multiple times, and some people do in order to get that volume that they desire. Some people like to just add a fat transfer to the breast on as part of a bigger liposuction procedure. And by that, I mean someone may be coming in wanting to do Lipo 360, helping to balance and shape that body. And they say, well, listen, as long as you have that fat, can we put a little bit of it in my breast just to help give it a little bit better of a bump? And the answer is we can. And I think that's one of the cool things of the fat transfers to the breast. The other neat thing about a fat transfer to the breast is it makes very minimal scarring on the breast itself. Implant augmentation breast lifts require scars that can at least get the implant in, or scars big enough to move the sap. In a fat transfer of the breast, we need to make a little nick in the skin that will typically hide along the areola so that you can't see it, and that's our border skin change. That's really all that we need to get access to put the fat in. And that, again, is another benefit of it. The procedure itself of the actual fat transfer takes about an hour. Now, if we're doing liposuction, that can change how long the procedure takes, but that can be gone over specifically in consultations and pre-op. The procedure is typically a general anesthesia procedure, meaning you're asleep, because we want to be able to liposuction and transfer fat. But if we were doing small volumes of fat transfer, we could easily do it as a sedation-like procedure. We have anesthesia provider and a whole OR staff team there. Roughly after that hour, you'll spend another hour in the recovery, and it's outpatient surgery, so you get to go home after it's all done. Now, we want somebody to be able to go home with you and watch you for the first 24 to 48 hours after this procedure. If that's not possible, we do have private nurses or recovery homes that you can go to. From a post-operative standpoint, I would like to keep you in a post-operative bra or a loose-fitting sports bra for the first 6 weeks while we let that fat sort of relax. From a liposuction standpoint, we will keep you in compression for the first 3 months. Again, just trying to help get things to squeeze down. Now, if we're talking about really small amounts, that may change a little bit. But if we're talking about large body contouring, we're at a 3-month mark. Now, it's extremely important that we talk about what are the concerns with fat transfers and why hasn't it always caught on as highly. Well, there's a couple of important things that you have to know about fat transfer to the breast, specifically in addition to the normal risks of surgery. Number one, you are injecting something around your breast, and that has the potential to decrease the abilities if we ever have to screen for cancers, either through mammograms or ultrasounds. Number two, when we inject fat, it can create hard lumps or cysts in the breast. And that can obviously cause some rightful concern and potentially some anxiety on your part. And it may require that you get a biopsy to get it checked out. Number three, studies have shown that certain types of mammograms, specifically digital MRI mammograms, can do a better job at detecting what is fat transferred versus actual breast tissue. But that does mean that you could, for the rest of your life, only be able to get digital MRI mammograms done. And it's something that I think everyone should understand when they get fat transfers to the breast performed. Doesn't mean that we don't do them. We do them a lot. And actually, we do them a lot from a breast reconstruction standpoint for people that have had breast cancer. So it is safe, but it is something that I want you to understand before you decide to move down that pathway. Again, it's got a lot of benefits. Take out fat you don't want, add it somewhere you do, but everything has pluses and minuses. Want to learn more? Come in for a consultation. We can talk about it. Want to just sort of browse around our educational videos? Great. Hit like, follow, subscribe. Check out all of our educational content. Want to see about other options for augmentations? Well, we talk about implants. We talk about fat from you. We can also get fat from other people. It's called Aloclay. Really kind of neat cutting edge stuff. So then, I'm Dr. Nykiel. Nice to meet you.